Hey, I'm Charles Raison, and our talk today is How Did We Get Here? A Brief History of Psychedelics. On the next slide, we can see our disclosures. One of the unusual things I want to add to the disclosure, actually, and Andrew and I were talking about that this morning, is that, we owe so much to indigenous communities in regards to psychedelics that I really want to acknowledge that I'm talking to you from Madison, Wisconsin, which is unceded Ho-Chunk territory. There's my other disclosures. So, I'm really fortunate to be doing this with Andrew Penn, who has, as anybody that's been in the Psych Congress family knows, has been so involved in teaching mental health in general, but who was so far ahead of the curve in understanding the importance that psychedelics were likely to have to our work, talking about it sort of like a light in the wilderness, but almost 10 years ago. So Andrew, I'm so glad we're doing this together. You have such a depth of expertise on the history of these substances. Let me turn it over to you.
Thanks, Chuck. I appreciate that. It's a lot of fun to be doing this with you. I am coming to you from unceded Ramaytush Ohlone land, which is now known as San Francisco. And you might, if you're not familiar with this practice of acknowledging the land on which people are coming from, the reason why this matters is that, at least particularly in this subject, is that, across the globe, humans have had relationships with plants, fungi, and in the case of alcohol, with yeast, that have allowed them to change their consciousness. And whether that's ayahuasca in South America or kava in the South Pacific, cannabis in the Hindu Kush, or peyote in North America, human beings have long had this complex relationship with nature. And while some of these plants and fungi have been used as intoxicants, more often these substances are sacraments. They're used to strengthen communities, they're used to heal illness, and to help people feel in communion with the divine. So the idea of taking them out of their original cultural context and reducing them down to their essential ingredients and calling them drugs to occasion a particular effect is the kind of extraction that has sort of characterized colonialism. And I want to recognize, as a white male descendant of one of those colonial nations, that me delivering a subject that has really largely been the domain of indigenous cultures should be met with a degree of suspicion. And I want to really do better with this. And so I hope that you'll participate in our Q&A to that extent, so we can broaden our extant knowledge. But so the history of psychedelics, for many people begins in the 1960s with the invention of LSD by John Lennon. No, I'm kidding. But to a lot of people, that is the thought that this is when this began. But really, the modern history of psychedelics began some 20 years before that, when this gentleman, Albert Hofmann, synthesized LSD while working for the Sandoz Corporation in Switzerland. But it was not, that was in 1938, but it was not until 5 years later that he accidentally ingested some and then had a famous, bizarre bicycle ride home, which we'll talk about. But, a lot of people forget that in psychiatry, there was this period of serious research that went on for about 15 to 20 years, in which it said that there's about 1,000 papers came out of that time and several international conferences. But many people are only familiar with LSD and other psychedelics as being lumped in with drugs of abuse, as they were called in the Controlled Substance Act of 1970, which was signed by Richard Nixon. He called drugs public enemy number one and declared the war on drugs, which was carried forth by subsequent administrations. As I've heard it said recently, the war on drugs has lost, and drugs are suing for peace. But in the last 25 years, there's been this real thrust of serious research into these compounds, which we'll talk about a little more in here. And I think it's important to acknowledge that this has all happened at a time while the war on drugs has continued, and many people have spent time in prison for altering their consciousness. But this history, as you see, each of these dots represents 10 years of time, that this really goes back much further than this. This is Maria Sabina. Obviously, this is a more recent picture from the 1960s, I believe. She was the person who introduced psilocybin to North America. She's a Mazatec medicine woman, or curandera. And there are records of psilocybin being used well before, the Spaniards acknowledged it, they were very fearful of it. They thought it was part of paganism and worked very hard to stamp it out. But that this tradition goes back in Mesoamerica, probably at least 1,000 years, if not longer. And then we go even further back. So now going further back into ancient Greece. So this last year, there has been a fascinating book published called The Immortality Key, talking about how the Eleusinian mysteries of ancient Greece were likely in part fueled by psychedelic plants and fungi. And even further back than this, so now going back 6,000 to 9,000 years. So it's thought that there is evidence of peyote use in North America going back about 5,800 years, and anywhere between 6,000 to 9,000 years in North Africa. There is cave painting evidence. The illustration on the right is a cave drawing in what is now Algeria of what appears to be a shamanic character with psilocybin mushrooms emerging from his hands. So point here is that we have been altering our consciousness for a long time. And what we often call the psychedelic period is actually only a very small portion of known history. Chuck, I'll pass it over to you.
Yeah, that's right. Thanks, Andrew. So get the next slide. It's an interesting thing. Why would a plant go to all the trouble, or in the case of a molecule called 5-MeO-DMT, why would a toad go to all the trouble of synthesizing these chemicals? We don't know, but best thought is that that often these chemicals are synthesized as a deterrent against being eaten in unwelcome circumstances. And just to make a point, this is sort of interesting, Andrew, that this is not unusual. This is not unique to psychedelic substances or the plants that produce them. Vegetables, many of the benefits, many of the nutrients we get from vegetables are kind of poisons, or things that the plants produce to try to control being eaten. And so it ties into this idea that I'm interested in about adaptive stressors, that sometimes, we actually benefit as beings from a little bit of substances that in larger doses can be toxic or problematic. So it's not the fact that plants produce these compounds that have this effect on us. It's not surprising that they may have initially evolved as deterrents. And although there have been some theories that maybe humans co-evolved with psychedelic substances and enhanced our consciousness, I think the standard brand's evolutionary understanding would be that we are sort of unexpected end hosts for these plants in terms of taking them. They didn't evolve to be eaten by us. It is a very, very fortunate historical accident that we've discovered that they have these properties. Now, of course, once that discovery is made, then they have this profound effect on individual humans, and from that have this potential to have profound effects on cultures, which we're going to talk about. So next slide. Certainly, I think this was the case in pre-Columbian North and South America. There's just increasing evidence that indeed, mushrooms and cactus plants played really major roles in a wide range of cultures, from the sort of large-scale cultures of Mexico and South America, down to the smaller-scale cultures of places like where you and I grew up. So, Andrew, you're lucky you live in San Francisco. I'm a California exile. But the use of psychedelic substances was hugely important in indigenous groups in Central California, where I come from. They didn't have a wide selection. They had datura, which is a very problematic cholinergic agent. They felt so strongly about the use of these agents that one of the things that some of the groups would do at puberty initiation would actually be to have the young people lay down naked on top of these large ant hills and have their bodies covered with ants. And although we don't know exactly chemically what it was, this was done to induce psychedelic experiences. So again, widespread use in the New World in pre-Columbian times. Again, pointing to the fact that the use of these agents was widespread in human history. It's ancient, and really in many ways, we are very, very recent interlopers into this space. So Andrew, back to you, I think.
Yeah. So this idea of asking patients about their inner world sounds weird, right? We talk about this in psychedelic work of engaging an inner healer. Well, this is not a new idea. So in addition to these being religious sacraments, as they often were thought to put people in communion with the divine, there's a history of medicine when working with mental maladies, asking people to examine their inner worlds. Now, in ancient Greece, Asclepius was the god of healing. Asclepions were hospitals. This is the ruin of the Asclepion in Bergamo, Turkey, where I went a couple of years ago and poked around. It's a rather amazing place. These are some photographs from what remains there. But this idea of engaging your inner world, be that dreams or visions, is newer than 2,500 years ago. If you think to our more contemporary colleagues, Freud and Jung, this was a significant part of their practice. So this really isn't anything new for our field of psychiatry, although we've sort of gotten away from it in the last 30 years or so with biological psychiatry. But for the rest of this talk, we're going to focus on what is often referred to as the modern era of psychedelics, so exists starting after 1943. And I think it's worth pointing out that that period went from 1943 to 1970 when the Controlled Substance Act was signed by Nixon. And the early signs of a thaw were, I would say, 1986, when Rick Doblin, one of our fellow presenters, founded the Multidisciplinary Association for Psychedelic Studies with what was a rather bold and maybe unrealistic vision at that time, at the height of the war on drugs, to make MDMA a prescription medicine. But it wasn't until 1994 when Rick Strassman published the first paper in the modern era on DMT that this sort of contemporary psychedelic renaissance, as it's sometimes called, began. And interestingly, if we bring that to the forward day, both of these periods of time have been 27 years long, which I think is fascinating, because I think a lot of times we think that this modern era is fairly nascent and that the previous era went on for decades. And in reality, there are now equal periods of time. So I think this is kind of fascinating. But it's important to talk about LSD in this history, because in this modern history, because really this is often pegged as a starting point. So again, this is Albert Hofmann. He was a chemist working for the Swiss drug company Sandoz, and he was investigating ergotamines as potential precursors to drugs that they then called analeptics. And analeptics were respiratory and cardiac stimulants. And he was working with the rye ergot fungus and synthesized accidentally, really, something called LSD 25, lysergic acid diethylamide. It's a curiosity that we still use the S for sour in German. Really, it would be LAD would be the chemical name for it. But it was not until 5 years later. So he synthesized this in 1938. But in 1943, it said that he accidentally ingested some in his laboratory and began to feel very strange. And it was he didn't particularly like the feeling, but as an empiric scientist, he wanted to understand this better. So 3 days later, on April 19th, 1943, he purposely took 250 micrograms, which he thought would be a very small amount, and began to feel very strange again, and was accompanied by his 21-year-old lab assistant, Susie Ramstein, who stayed with him as he rode his bicycle home, what became known later as Bicycle Day. And really, arguably she was, well, not arguably, she was the first psychedelic guide. And it was 2 weeks later that she also tried this new compound and became the first woman to ever ingest a psychedelic, modern psychedelic compound. So when he went home, he reported that the experience was at first frightening, but then later he began to experience kaleidoscopic, fantastic images surged in on me, alternating, variegated, opening, and then closing themselves in circles and spirals. So he discovered this drug, which Sandoz said, well, this is very interesting, but we're not sure what to do with it. They marketed it as something called Desilid. And they said, we will give a sample of this to any responsible physician with the request that they report back what they did with it. And so many psychiatrists around the world took him up on this. You have to remember, this is well before prohibition. This is well before the youth culture got a hands on it. So people like Roland Sanderson, pictured here in the UK, was using it in psychotherapy. This is Humphrey Osmond, who was in Saskatchewan, Canada, who was working with people with what we would now call alcohol use disorder, along with a nurse named Kay Parley, who is still alive. She's 98 years old and has written about her experiences as working with patients being treated with LSD. And also people such as Stan Grof, who was trained in Czechoslovakia, but came to Johns Hopkins in 1967 and worked with people like Bill Richards and Walter Pankey on studies at Spring Grove, Maryland. But you have to also remember that before this drug ended up in youth culture, the literature was already interested in it. So this is Aldous Huxley, the British writer, perhaps most famously known for Brave New World, his dystopian novel. But he was actually introduced to mescaline by Humphrey Osmond in 1953, and a year later to LSD, but also by Humphrey Osmond in Los Angeles. And he wrote about his mescaline experience in the 1954 book, The Doors of Perception. If you're familiar with the 1960s rock group, The Doors, this is where they got their name from. And this is also the reason why I got interested in psychedelics, because I read this book when I was 16, and I found it absolutely fascinating. And it was actually a correspondence between Huxley and Osmond that coined the term psychedelic. The letter that is often quoted was that Osmond said, "To fathom hell or soar angelic, just take a pinch of a psychedelic." And his last book, Huxley's last book, Island, which was written the year before he died, was about a fictional island society where an unnamed, clearly psychedelic compound named moksha was used much in the same way that Chuck described the ant ceremonies of Central California. It was used as part of initiation rites, it was used at death, and it was used to solve challenging problems. And Huxley, as a footnote on this, actually died from laryngeal cancer the same day that Kennedy was killed. And he asked his wife in his dying moments to inject him with LSD. And so he went out of this world tripping. It was also at this same time that the CIA began its famous MK Ultra operations, where they were seeking mind control or incapacitation agents, and went on very unethically to expose many people to compounds such as LSD to study their effects. And it was actually Ken Kesey, who later went on to become a merry prankster and the author of the electric acid Kool-Aid test, who was working at the VA hospital in Menlo Park, California, who was a subject in one of these MK Ultra studies and was exposed to LSD. And it was also around this time that Bill W., the founder of Alcoholics Anonymous, had an LSD experience that was given to him by Betty Eisner, which he said was similar to the belladonna experience that he had in the 1930s, which was given to him as an attempt to cure his alcoholism. So very interesting pre-youth culture period. And Chuck, you want to talk about what happened next?
Yeah, so one of the interesting things about things in this universe seems to be that opposites often engender each other. Jung actually coined a term enantiodromia to get at this idea that one extreme often gives rise to the other. This is like, right, Andrew? I mean, this is like the ultimate example of that. So you get this CIA thinking, wow, these agents can be used for mind control to bring people in line, and you let the genie out of the bottle, and you get these completely unpredictable effects. In this case, very much the opposite effect, where these agents became, in many ways, synonymous with resistance to the man, resistance to the generation above, resistance to the ethos of the 1950s. These two gentlemen are often considered to be the heroes or the demons or the villains of this particular narrative. They look like perfectly respectable gentlemen, and they were. On the left is Timothy Leary, on the right is Richard Alpert. They were psychologists and researchers at Harvard, and they began, as you were saying, Andrew. I mean, there was all sorts of studying of these agents going on, and Leary was he was a serious psychologist. He'd done some serious work, was well respected. But had a different take on psychedelics. And of course, over time, eventually becoming, Nixon said he was public enemy number one, right? Eventually became this voice for turn on, tune in, and drop out. And had this vision, in fact, that psychedelics would be transformational for society. And remember, in these are the years that Vietnam is heating up. There's this increasing dichotomy between these older sort of World War II inspired ways of looking at the world and the youth, which were at this moment, sort of everything was opening up and had this very, very different sort of vision of nonviolence, world peace. Why don't we hit the next one? I think this goes to our buddy Ram Dass, doesn't it? Right. So this is really interesting. The gentleman on the right in the top picture is the gentleman on the right in the bottom picture. So this is Leary and Richard Alpert. Alpert, in fact, went to India and met a guy named Baba Neem Karoli, who was a mystic and guru, and had this unbelievably profound experience. As you know, Andrew, I was lucky because of some of the work I've done in psychedelics. I was able to spend a couple of days with Ram Dass a few years ago before he passed. He was a profound human being, but he had a critique of psychedelics, and it was an interesting experience sitting with him because we kind of wanted to engage with him on psychedelics, and his position on these agents were hugely useful, but you always come back to your typical self in ways that are frustrating, and it frustrated him. So he turned to the spiritual path. So these two men, in their different ways, diverged, and you can see the currents of the 60s in them. Leary goes on to then become this sort of emblem of the protests against Vietnam, civil disobedience, eventually Nixon. Ram Dass goes this other way, Be Here Now, and gives birth to the New Age movement, gives birth to a lot of the spirituality of the 70s, or certainly at least articulating those things. And then there's the music. And I just, it's interesting, I was just reading this morning about LSD. Paul McCartney says, don't overestimate the effect that LSD had on our music. But there is no doubt, and there's been written about a great deal, that especially LSD, but psychedelics in general, changed how music was understood. During psychedelic experiences, music can often be extremely evocative and powerful. And people began to try to create music that got at some of that, Inagata Vita, baby. I mean, man, you can hear that shift that psychedelics are driving in popular culture.
Chuck, I always thought that Lucy in the Sky with Diamonds was a reference to LSD, but
I know.
apparently Lennon denied that. He said
he denied it. He said it was from his kid Julian.
Alice in Wonderland, yeah. But he said Tomorrow Never Knows on Revolver is from the Tibetan Book of the Dead that Leary and Alpert wrote after they were fired from Harvard.
Yeah. Yep, exactly. Interesting, of course, then they went off to Millbrook and continued their work. So anyway, and then, of course, you and I were talking before we started recording this. So I actually met Nixon. My dad we were journalists, and he put me on a couch. He said, Nixon is going to walk right through here, And he walked right up. I hopped up. Oh, Mr. Nixon, I can still see him. He's much better looking in person, actually. But one of his, kind of more dubious, as you sort of alluded to, decisions was to enact this war on drugs. I mean, he just, and of course, his downfall was sort of the end of this era that's on this slide. But one of his enduring legacies was the war on drugs. And interestingly, the research on psychedelics, I think, is contributing to a current reevaluation of that stance on drugs in general, certainly on psychedelic agents. So I think the key point here, though, is that these agents, the huge difference between your slide and this slide, and actually Leary and Alpert, it's such a great picture with their ties on. This is what happened through those years. And so when these agents got out of the lab and out of the clinic in this way, they set off a reaction that just closed them down. And that's the next part of the story, I think, in part. So
yeah, actually, we're going to talk about ketamine next.
Okay.
And then yes, to try and do this, the history of psychedelics in 35 minutes is an unenviable
it's a bit
task.
of a challenge.
Yeah. So I'm going to shift gears a little bit and just talk about ketamine. So ketamine is we're going to have content on ketamine in this conference. And so ketamine has an interesting history because it's not a plant-derived drug. It is a pharmaceutical drug, and it was created by Park Davis as a alternative to phenylcyclidine, also known as PCP, which was also a surgical anesthetic, even though it has a rather sordid history as a street drug. But PCP had problems with emergence delirium as an anesthetic. And so they created ketamine, which has a similar structure, as you can see there, and actually works on the same site in the NMDA receptor. which is known as PCP site actually. But it was safe enough that because it preserved airway function, that it could be trialed out in Vietnam as a battlefield drug. So soldiers were given morphine and ketamine to be able to administer to wounded fellow soldiers to help with their evacuation. And it went on to be used largely as an anesthetic in commonly used in veterinary medicine. This is probably where it gets the nickname as a horse tranquilizer, which is really probably not well earned, and also interestingly in pediatrics. And the reason for this, again, airway preservation and short acting duration. So you can reset a broken arm and the kid will be back to normal in an hour or two and send him home. So it went on for a couple of decades, really, without anybody really appreciating that it had a place in psychiatry. It did get diverted into the sort of rave scene as a club drug that was often veterinary ketamine. That would be the liquid would be taken, dried out on a hot plate, and then it could be insufflated. And that went on. That's probably where it got the name Special K from. But it wasn't until 2000 when Robert Berman and his group at Yale published the first antidepressant study. And this is an interesting study because they actually set out trying to make a psychosis model. And I am aware that my slides are oddly numbered here. You are not imagining things.
Hey, that's the psychedelic way, though, right?
This is the embedded psychedelic
It's non-linear,
experience,
man. It's
right?
non-linear.
That's right. You can eat this presentation when you're done with it. Yeah. So they were looking to see if they could actually make a chemical model of psychosis for purposes of studying. And what they actually found was it had this rapidly antidepressant effect within a few hours to a day or so that wore off after a week to two, sometimes less, sometimes more. And this sparked a lot of interest and a number of papers and replications in both unipolar and bipolar depression. Let's see what number comes up next. We're back to 4. And so ketamine never got an FDA approval for depression because, as you probably are aware, most people don't bother spending a lot of money to get a generic drug reapproved for something. So it just got used off-label all over the place in these ketamine infusion clinics, often run, interestingly, not by psychiatry, but by anesthesiology, who definitely saw an opportunity for a procedural treatment. And then in 2018, the FDA approved S-ketamine, which is the left-handed enantiomer of racemic ketamine, as a rapidly acting antidepressant delivered in an intranasal spray, jokingly often said because psychiatrists don't know how to start IVs. And that has had a place now as a rapidly acting antidepressant for the last couple of years. And there's a couple different ways of looking at ketamine. So that sort of ketamine infusion model is often done 0.5 milligram per kilogram over 40 minutes. It's often not a robustly psychedelic experience. Some people do have some psychedelic experiences. It's interesting, the makers of S-ketamine refer to it as dissociative effects, which I think is kind of curious. But regardless, it's really not, the journey is more thought of as a side effect. Now, the psychedelic model of using ketamine is more akin to the psychedelic assisted therapy model, which you're going to hear a lot about over the next couple of days. And this is, as you can see, usually you are attended to this. The patient is attended by 1 or 2 therapists who have done preparatory and integrative work afterwards. And as you can see, this person is sitting on a couch with headphones and eye shades on with their attention directed inward. When ketamine is used in this way, typically it's oftentimes it will be started with a sublingual dose, and then as the person becomes more conversant in that state, we'll go to an IM push. But in this case, it's really much akin to the psychedelic model. The journey is really of the interest, and a person who really deserves a lot of credit for pushing this idea long before it was popular is Raquel Bennett, Dr. Raquel Bennett, who founded the Korea Institute here in my neighborhood and has done a yeoman's work of talking about ketamine as a therapeutic. And then finally, before Chuck, turn this back over to Chuck, talk about psilocybin, which is really in his wheelhouse, I want to talk about methylene dioxymethamphetamine, or MDMA. So this is a drug that was actually patented by Merck in 1912 as something, they called it methylsaphylamine. And it was never thought to be a drug by itself. It was actually a drug in the sequence. They were investigating drugs for treating hemorrhage. and it was not tested on humans, so nobody really knew it was psychoactive. There was a drug called methylendioxyamphetamine that was marketed as a diet drug by SmithKline and French in the 1960s, and was also investigated by MK Ultra as an incapacitation agent. But often there's this sort of misunderstanding that MDMA was created as a diet drug, and that's not actually true. But it sort of sat in obscurity until the 1970s, when this gentleman, Sasha Alexander Shulgin, who had made his career working as a chemist for Dow, he created a biodegradable insecticide called Zectran, which was so popular and so successful that they basically gave him free rein to kind of tinker around and play with chemicals and see what he could come up with. And his backyard hobby was working with phenylethylamines and tryptamines, which are the backbones for psychedelic drugs. And he was a classic sort of empiricist scientist. He would make a small tweak on the molecule and then try very small doses on himself. And he took copious notes. And if he thought the effect was useful, he would share it with a small group of friends, including his wife, Anne, who is pictured here. And they wrote a couple of large volumes, PCAL and TCAL, in which all these experiences and drugs are, the formulations for the drugs are preserved. And he had a colleague named Leo Zeff, who was a therapist who had done a little bit of work with LSD-assisted therapy in the pre-Prohibition era, who was working as a couples therapist in the San Francisco Bay Area. And when he synthesized MDMA, he said, this is really interesting because it seems to have this capacity for deepening empathy. And he thought, this might be really useful in psychotherapy. And so around 1976, he shared this drug with Leo Zeff, who created an anagram. He called it Atom, because he thought it sort of returned you back to this primordial state of almost childlike wonder. And people like George Greer, who were using it in psychotherapy, actually called it empathy. But it wasn't until the early 1980s so remember, this didn't become a Schedule I drug until 1985, where this got out into the nightclub scene. And there was some very interesting history about this. Dallas, Fort Worth, interestingly, you could buy this over the counter at bars. And there was a large trade in Texas of MDMA, but it got out into the rave, the nascent rave culture at that time. And you have to remember, this is the middle of the height of the drug war. Reagan's America, crack cocaine is in Time magazine. White powders, people didn't really understand the difference between them. And they said, the DEA said, we're going to put this on Schedule I. They did that. I'm sure Rick Doblin will probably talk about how they did that against the advice of a lot of the psychiatry community who saw its potential effects. But nevertheless, it was put on Schedule I in 1985. Rick Doblin goes on to found MAPS in 1986 with the goal of creating the knowledge base that would support an FDA indication for this as a prescribable medicine. And with the help of many people, but spearheaded by Annie and Michael Mithofer as the primary investigators in the first studies, really began to create the evidence base for this as a prescribable and effective treatment for PTSD when supported by psychotherapy. And that effort is now in late phase 3 and is probably looking at FDA approval if all goes continues to go well, around 2023. Chuck? Back to you.
So MDMA is probably in the lead of agents that are most likely to get FDA approval, but psilocybin, I think, is certainly coming up, galloping on its heels. So let's talk about the history of psilocybin. It's pretty clear that when the Spaniards blew up the culture in Mexico, the Mesoamerican culture, that they recognized that mushroom rights, mushroom use was widespread, powerful part of the culture, but it really was suppressed and it vanished. And it is amazing to me that, all the way into the mid 20th century, people thought it was a myth. They didn't believe it. They couldn't find any evidence for it. There were some folks that identified some psilocybin type mushrooms in the 30s, but nothing much came of it. But where it really broke into the Western consciousness, with the ground being prepared by the prior development of LSD, was when a gentleman named Gordon Wasson, who was an executive in New York City, went down to Huautla de Jimenez in Oaxaca, and had an exposure to psilocybin in a very traditional healing ceremony by this curandera that you mentioned, Maria Sabina. Now, interestingly, Gordon Wasson's the name that people remember, but it was really his wife, Valentina Wasson, who was an obsessed genius of mycology. She wrote one of the great, there's only 512 copies apparently that ever existed, but the uber text of all texts about mushrooms. And she's the one that got Gordon, we can see here, interested. They went down, they wrote a couple of articles. The big one was an article in Life magazine. It had really a major impact on the culture. It was one of those kaboom kind of moments. Next, partly because, of course, it's an amazing experience you wrote about, and partly about because it's like a kind of a Indiana Jones mystery. Oh my God, it turns out these things have been used for hundreds of years in underground since the Spanish conquest. So here's our buddy Albert Hofmann again, who was a big player in these early days, and he was able to synthesize psilocybin, which is the active ingredient in terms of psychedelic effects in the psilocybin mushrooms. This occurred in 1958. He interacted with Wasson a lot. Then much like with the Desolid, Sandoz once again marketed psilocybin as indocybin, and it was on the market from about 61 to 65. So not as long a period. And if you dig into the research literature from the 60s and late 50s, the vast bulk of the work was done with LSD. I mean, people did studies with psilocybin, but it was much less frequent. And we've alluded to the fact that 27 years ago, this sort of modern era began. And one of the linchpins of the institution, that modern era, was the founding of Hefter Research Institute in 1996. A number of people, George Greer, Dave Nichols, others, that were interested in this area and wanted to research, got together and put together what was really a very small society where they met, they shared projects, and they fundraised. And those were lean years because there was no way to get any type of government funding for this, but they were able to begin to set the stage and launch what has become now this literally multi-million dollar industry that's emerged in psychedelics in the last few years. I think a key moment in all this is a friend of mine who actually I'm going to see later today. USANA Institute's having their groundbreaking ceremony. Bob Jesse had been a VP at Oracle and deeply believed that these agents had the capacity to offer promise as transformative elements for society, that they could be integrated into society in sort of non-dogmatic spiritual ways. He founded a group called the Council on Spiritual Practices and held a legendary meeting in the history of psychedelics at Esalen in around the same time, 1996. Convened folks from FDA, from DEA, religious scholars, and they decided that they were going to pursue active research in psychedelics. They chose psilocybin, and they asked different people, they'll tell you different reasons. The classic reason was 3 letters. They would say it's not LSD, it doesn't have the same cultural baggage. I know Bob Jesse also was interested in this molecule precisely because it was available in nature, and so harder to patent, harder to control in a purely pharmaceutical way. He had much more of an appreciation for the potential of these plant medicines as plant medicines. But one of the things that Bob decided was they needed to find a top drawer, just squeaky clean researcher who had real pedigree in drugs of abuse and pharmacology. And they hit upon a lovely, brilliant gentleman named Roland Griffiths, who was a professor at Hopkins, who had his life transformed by meditation practice. So he had a sort of a sense of the transformative potential of altered states of consciousness. And he began, starting in sort of the first years of the 21st century, a very cautious, strategic research program looking at psilocybin. And with him here, he's the white-haired gentleman middle to his left. Matt Johnson is sort of the next generation coming out of Hopkins. Has been so important, especially for the psychedelic work, the substance abuse work. And Mary Casamano, who has just been this astounding guide. They began publishing a series of papers in Healthy Normals showing that psilocybin induced powerful experiences that people actually prized for significant lengths of time. They found some evidence that psychedelic experiences with psilocybin might change people's personality, make them more open to new experiences. Next slide. We can hit the next thing. Then the first clinical studies began in the mid-2000s. Francisco Moreno at University of Arizona looked at psilocybin without a lot of therapeutic support for OCD, found a signal. Charles Grove in UCLA published the first trial in cancer, small trial, suggesting it had benefit. Around the same time, with a lot of support from the Beckley Foundation, Robin Card-Harris, David Nutt, Roz Watts began to do clinical and basic and more translational basic science studies to look at what do psychedelics do in the brain that might account for their therapeutic effects, and showing, along with the folks at both Hopkins and we'll talk about in a second, NYU, showed that these things have antidepressant potential. USONA, for which I serve as Director of Clinical and Translational Research, was founded in 2014 with the goal of getting FDA approval for psilocybin for major depression. Compass Pathways, a commercial entity, was founded in 2016 with the goal of getting FDA approval and European approval for psilocybin for treatment-resistant depression. Bill Linton and George Goldsmith, the leaders of those efforts. Landmark cancer studies published in 2016, one from Hopkins, and one from NYU, Steve Ross, Tony Bossis, Jeff Gus, showing that a single treatment with psilocybin produced remission rates in depression and anxiety of 70% at 6 months after a single treatment, suggesting that these agents are especially powerful, perhaps, for these psychiatric conditions that are framed by problems, existential problems, and other problems that these profound psychedelic experiences sometimes address. Based on these data and based on sort of the gestalt of the field, breakthrough therapy, which is a very special designation given by the FDA for potential treatments that show remarkable promise and unmet medical needs, has been granted. USONA got breakthrough therapy in 2019 for psilocybin for major depression. Compass Pathways got breakthrough therapy in 2018 for treatment-resistant depression. And then, of course, we've been talking about pharmacologic activity, but there's also been a lot of advocacy. And I think one of the most interesting was the bill passed in Oregon in 2020 that in 2 years would allow the use of psilocybin with licensed clinicians in very constrained settings. But this is another very novel way that these agents are beginning to come into not just the culture, but into, I think, clinical practice. So, Andrew, I think that's it. We're out of time.
I think we are, yeah. This is a this is a whirlwind tour.
I know, I was talking fast there at the end.
No, I remember one of my teachers, Bill Richards, said sometimes a psychedelic experience is like roller skating through the Louvre Museum.
Yeah.
And you have to, it takes some time to integrate it because you saw so much. And I think our audience might need a little bit of time to digest this, but I do look forward to getting to answer a few questions after this. So
Absolutely.
thanks, Chuck.
Yeah, thanks, Andrew.